Welcome to Diacom Software Training. Training is provided by Diacom's Latin American and Caribbean Tech Support Department. This time, we'll take a look at three programs working both for diagnosis as well as for treatment. Those are Diacom NLS, Diacom FREC, and Diacom URC. It's worth remembering before starting that in the equipment's rear part you'll find the power button, which shall, obviously, be in on position before opening any program. Then there's also indicated in the plate the location of devices which shall be connected to equipment for correct performance of diagnosis or treatment. Those shall always be appropriately placed, be that the bioinductor, resonant base, or the FREC therapy cables. As the equipment is turned on, the green button at the front shall always be on, indicating that equipment is appropriately set up. Before starting diagnosis, the patient shall be either sit or almost lying down. Cable for the bioinductor shall always be to the left of the patient, to our perspective, to the right. Once the bioinductor is placed on the patient, double-click on Diacom NLS program. And then wait for it to load. It is of utmost importance for the patient to always have bioinductor placed. For, as we can see, equipment as the program starts sends a specific frequency precisely in need of reception, showing that it is placed on a patient. As we can see, equipment at startup welcome screen. So we'll analyze 4 buttons of this window, such being patient reception, about the program, setup, and exit. As hinted, exit button works to terminate. Setup is for equipment configuration. Always, deviation process correction bar shall mark at the middle. It should never be modified, because that thing is only changed by us programmer, and if you ever move that, it could result in deconfiguration of the equipment's sensitivity. Option for color images, set by default, works for color provision to virtual schemas inside diagnosis. Translator works for the provision of different languages, English for instance. As we point through the mouse to structures, once visualization is in progress, a brief translation hovers over the area we're analyzing. We revert it to Spanish, and we wait for strings to automatically change to that language. Another option which is set is music, that is, for times when the equipment does diagnosis or treatment such as metatherapy, it plays a sound, a sort of animation, which works for us to know what is going on in the equipment. We'll see that later. Mute sound works precisely to remove this sound and all other alert sounds produced by the equipment. Press close button. Let's go over the next button, about the program. By pressing this with the left button, a blue square will appear with credits for it, listing the doctors who started investigation and the university or universities in which the doctor performed tests. In order to close this window, we simply press once again with the left button. The window closes automatically. And last but not least, the remaining button, patient reception. It refers to the area of patient reception to finally perform diagnosis. Here we'll be able to enter this window, which is for patient reception, useful precisely for patient data input. Along with the doctors we already have, or with a new doctor we wish to create. And so, for instance, we wish to create a new doctor. This way we enter the name, last name of the doctor, but if on the contrary we wish to delete that profile, that doctor which we created, hit on delete, and it will tell us if we wish to proceed. We'll eliminate all associated patients. But since we have no patients yet, then we can safely remove this. Enter here on button Doctor. Press OK. Right here, it will always be the name of the doctor which we have entered. That is very important for patient data. Appears right here, as well as the name of the doctor this patient belongs to. Here is the doctor, this being an example. We'll set it again for button doctor. OK. So we'll enter patients. A new patient, in this case. It is preferred to enter, for clinical history, the patient's ID number. Then the name. Age. Gender at last. Now the system needs only these three items: name, age, and gender. Address and phone number are not compulsory to enter. To have a more complete clinical history, though, patient's address and phone number, database-wise, are important. Then we see two options. One is selected, the other one isn't. Option Anamnesis, set here. Then upon pressing OK here, a window will open called Interactive Anamnesis. Should that one be unselected, upon pressing OK, the system would analyze all available schemas in order to analyze, which would not allow us to do a very precise analysis because we did not enter symptoms or diagnosis which has been previously given with the patient. So it is worth remembering to enable an anamnesis option. That way, by pressing OK, interactive anamnesis window opens up, which will then allow us to enter symptoms, surgery, diagnosed for previous patient illness at any given moment. The second option, which can be enabled, is option Pay. And the reason to activate Pay is that upon pressing OK, a window will appear requesting for the value of the diagnosis to make. This is mostly used for an option used here, well, to see how many patients in a month a doctor has had, and what value all of those for that doctor have had. That's mostly used for accounting purposes. It's not necessary to use. After this input, we can finally press OK button, the window which appears precisely. It's interactive anamnesis, where we can enter symptoms as well as diagnosis. So we'll enter symptoms the patient has. For instance, press the button, turning green. That means that's where we wish to enter data. Say enter 09 headache. We may enter 1 up to 2 symptoms. All this to allow the system to be more accurate in certain areas. That doesn't mean that the system won't check other areas. Upon entering a certain set of symptoms, we simply fine-tune the system towards such areas. Supposing, say, that we already fed the system with information about a certain organ, it will now send the respective frequency for that is already noted. Even though, in the absence of an organ, the system has the capabilities for analysis of it anyway, because an energetic trace of it is present in the patient. Also, as diagnosis, we can enter for this very patient cardiac arrhythmia. Once symptoms and diagnosis are entered, we move towards the correction menu. And so, this window opens up for data collection, one that even at this point will allow us to enter more symptoms, should that be needed, an additional diagnosis. For this patient, he's had appendectomy, so we shall enter such item. In order to enter that item without erasing cardiac arrhythmia, we need to press this button, Diagnose Caption, which means to enter an additional bar. But if we enter diagnosis per se, it deletes the previous one. We need to create a new one. A new bar is entered. And so, look for the diagnosed disease. For this case, cardiac arrhythmia. Now press Enter. Note that this time the two bars present, without the case of overwriting one with the other. Once we enter the set of symptoms and diagnose surgeries, then we need to perform synchronization. Sync the patient's frequencies to the frequency preset in the system. This is to be done in the following step. Auto-Tune button, which causes all functions present in the system 246 appear. Then press Scan button. The system now performs sync. Then it no longer permits to enter diagnose and symptoms. Therefore, advanced input is required. This shall be entered before pressing Scan button. Now, once sync is performed, that will only be allowed to be done once. The first diagnose won't be allowed to be done once again. Press button on Check. This means to unselect, because the equipment, by auto-tuning and auto-scan, introduces a standard, what it considers preset for application to the patient. But to give us a greater freedom, we will unselect. Press Image button. Now we can go ahead and select the areas we wish to analyze in the patient. Right, we can do it right away. We can click leftover boxes to the side of each schema. We can also navigate up and down with arrow keys. And so to select, press spacebar once. If it's already selected and we wish to remove it, press over that schema, spacebar to discount it. Let's analyze a couple of them in this patient. Note that each set or system is printed in a color which helps to differentiate it. The first schemas are in blue. What these show, what they are, is magnetic and nuclear resonance imaging. Afterwards, we come to ventrointestinal system, on a different color. Yet with a different color, green, the respiratory system. Then another color, red, genitourinary system. Then in blue, cardiovascular system. Then there is lymphatic system in pink. Then yellow, the endocrine system. Red again, the nervous system, followed by sensorial system, skin, eyes, ear. Then locomotive system, another color, green. And finally, on dark green, what is the set of chromosomes and individual chromosomes to analyze in the patient. In the case, to be able to analyze the presence of microorganisms. So once we have chosen what we want to analyze, press Start button. What the system is doing right now is to send a frequency, via the right side of the inductor. Such frequency reaches the patient's brain to see the central nervous system. This frequency travels to the previously selected organs. Organs then produce a response towards the stimulus. The equipment fetches the response and then compares it to the pattern of healthy tissues. This kind of analysis, which we will review later, spectral analysis, which, although the equipment has 8 diagnosing levels, will analyze this, one of the most important ones, for it allows us to know where the illness resides in, or the stress for the organ we are analyzing. Basically, what we can see for it appears afterwards, to the right side, on a blue line, and a red line, which corresponds to anabolic processes for the organ or schema or tissue. Red one for catabolic processes or cell destruction. For the organ to work okay, both lines shall be parallel. Creation and destruction are in line. Wherever there is a greater separation among processes, it will tell in the respective area, it will signify in the planar graph in the manual, it will point to the area related. Let's note, once the virtual schema is visualized, a series of white dots appear, later to be replaced by graph levels, going from 1 to 6. Levels 1 and 2 relate to optimal functioning state, that which the tissue has. In the patient body, those levels 1 or 2, those will live literally for healthy children. That as long as there is no illness, for they have not been affected by lifestyle. Level 3 is an upward pointing triangle that corresponds to a normal level in an adult person. Those 3 levels, 1, 2, and 3, indicate there is no major malfunction in the patient's organs. Now, it is commonplace for patients for whom we know an illness. Levels 1 and 2 can show up, but then there's to take into account whether the patient has been taking a drug or a stimulant, or beverages like coffee in the previous 8 hours, for this generates a compensatory response in the system, and so shows as levels 1 and 2. For obvious reasons, it is advised not to ingest, if possible, not to take drugs for at least 8 hours before, so that the system doesn't show stimulus in areas which are actually affected. Level 4 is a downward pointing triangle. It shows a low energetic level for that area, that is, the area already has an ailment, there's a disorder. Level 5 and level 6 refer to the highest levels of distress which the function of organs can have. This is level 5, chestnut-colored rhombus, and the black square is level 6. It is important to reinforce that once scanning is over for each schema we selected, circles with 3 different colors will be visualized. The first one, a green circle, meaning there is level 3, and level 4 the highest. And for red circle, there are levels 4, 3, but also level 5. And when a chestnut-colored circle appears, it indicates that the schema has level 5 and up to level 6. This can be used to detect which schema, if you will, is worse than the others, which one is considered to be seen more carefully. Now we'll see through Analysis button. We'll analyze this area. We locate by clicking over the area we wish to analyze. We locate this way. and so we analyze. This is quite important. It is a very important tool in the equipment. We call it frequency biopsy or virtual biopsy. We only analyze this area. We only analyze this frequency. We discount all others. And so, we get two frequencies which are not equal. To be able to analyze them, the frequency of the organ, the total, general frec of the schema, and focus frequency, the one for the location we made, enter focus. And firstly, before evaluating, take some healthy tissue sample. What we're doing right now is a comparison of frequencies. Frequency for healthy tissue sample to the patient's frequency. Precisely the area we locate, the cecum area, ascending colon. Enter focus. We can select precisely cecum, then use the button spectrum, what corresponds to this image but amplified. This is one of the first level by our equipment, one of the most important ones. It allows to see what area is mostly in distress and which organ it relates to. We can, for instance, see as hinted the blue line and red line corresponding to anabolic and catabolic processes. As for the patient, his lines aren't those, but his are the purple and yellow ones. So blue and red correspond to healthy tissue sample. In this case, for the cecum, if we take for instance node lymph rectus back to cecum. And so the purple line, as mentioned, corresponds to anabolic processes for the patient for this schema. Yellow line, catabolic processes. Note that there's a degree of similitude of anabolic processes. Still, there is certain difference, but there is a wider difference on catabolic processes as compared to anabolism. We note that each area is represented by a number in the lower part. We'll assess it through planar graph, which is in the manual. We'll assess which organs it relates to. It's not that I say that it's not important for the purple line to surpass the yellow one, but it's more dangerous than there is more being destructed than it is created in this area. For this case, the relationship of 1.8 is with bone and thick connective tissue, and in 2.6, porous connective tissue, main arteries, veins, up to capillaries, and erythrocytes, that is, blood. We also see 4.2, an ample difference corresponding to glandular zone of the mucosae, the intestinal system, the reproductive and urinary system, gallbladder glandular tissue, and for women, ovaries. There's also an ample difference at 5.8 corresponding to pancreas secreting function, ovaries in women, nerve endings, and epithelium of superior airways, rhinopharyngeal. So those are the areas as reported by the system which show up as having malfunction. Then, precisely for the first schema we picked, in the superior airways, there is distress. What we're doing next is location of this area, assess again, to proceed over it. Enter focus area again, organize. We're not taking healthy tissue samples what more, but pathomorphology, gnoseological forms, and microorganisms. So, an ample system will appear between pathomorphology, gnoseal forms, microorg. These correspond to illnesses, syndromes, and microorganisms which obviously correspond to fungus, parasites. Note that by each etalon in this listing, Each of the options is an etalon. Firstly, each one has a different color. Actually, color is to determine the classification, where it's at. For instance, tonsillitis, the system located it here. A microorganism possesses a gray color as it corresponds. Now, next to each etalon, there's a value. In this case, it goes from 0.017. At the end, it's 41.568. This is important because when a pathology is inside range, going from 0.425 to absolute zero, it shows in red, no matter what its classification is. It shows in red. And it means that such pathology or microorganism resides in the patient. In 70 to 90%, a mathematical match of being present in the patient. As indicated, it's in the state of the moment of the patient. Now, we have the possibility to perform entropy analysis. Entropy, as is shown in the second postulate of the thermodynamics law, indicates the level of disorder present in matter. Here, when we set out to analyze an ailment via entropy, it will return a scale or a graph with 7 levels. It goes from 1 to 7. As this is in level 1, that means it hasn't developed. All the contrary for sickness showing up in level 7. Obviously, the higher we go, the worse the condition is. On level 2, level 3, that means it's in inception phase. Obviously, levels 4, 5, when it has a clear manifestation. Needless to say, level 7 means a fully formed illness, thus the equipment is so important for it shows trends. What it shows in a preemptive analysis, for it shows what might occur. So as stated, this is the real state for the moment for the patient. But if we go further, for G forecast, G means general forecast, it changes all etalons. This change to black. Their value changes. They can change either approach 0 or depart from 0. As for tonsillitis, it has 0.817 and it approaches 0 by 7:30. It approaches 0. Prepare G forecast and check entropy level for it to have. Keeps on level 1. Let's see inflammations of lymph ganglions. Level remains in this area. No further complication in sight. Okay, so let's take another schema. Let's take intestinal areas. Visualize. Locate it. Take the level with highest distress. Level 6. Assess it. Enter focus window. Now, as previously indicated, everything appearing in the range 0.4 to 5 shows red no matter what its classification is. This means that this is active in the patient. It is possible that no symptoms manifest, but this is active in the patient. Information is present in the patient. For frequency sent by the system, the patient's body responds to stimulus, and by getting such response, the graph is precisely saying that the frequency at the colon, asymmetrical, the secus is similar, quite similar in fact to that of Ascaris lumbricoides, to that of the patient. And so it goes. The further it departs, the less similar it is. That is the current moment state for the patient. Then press for G forecast. In the future, we see colitis and enteritis become active, so there's a tendency to colon inflammation. Only pathologies and nosological forms are those allowing to measure entropy level. Microorganisms do not. Microorganisms are not permitted to be analyzed through entropy. Illnesses likewise, we can go ahead and check G forecast. We can see whether levels remain the same, worsen, or even diminish. Such occurs in cases of a patient who has initiated some kind of treatment, where it reads that instead of going up, that has gone up to 4. This, for instance, was in 5 and went back to 2. This means, should the person be in treatment? Well, it's being effective. Before exiting, in this very schema, I'll explain of optimum distribution caption right here. Just as it reads, just as with etalons, it has a value. This time is 1.976. So if values range from 0 to 1.3, then the organ is hypofunctional. It's working less than it should be. Going from 1.3 to 1.8, this means that the organism is working appropriately. And 1.8 and up, it means that the organ is in hyperfunction, working more than it should be. Now, we will also use another tool, etalon object. This allows us, let's remind ourselves that every option from this side, GNOME etalon, this allows us to select an etalon and see what it is related to ultimately know, for instance, when several microorganisms are attacking a given organ. For instance, let's select Ascaris lumbricoides and press etalon object. Automatically, G-forecast disappears. Now it tells us, obviously, that it does. It's placing Ascaris lumbricoides in absolute 0, and it tells us that, obviously, Ascaris lumbricoides, the organ has a disease related to Ascaris lumbricoides, and at the same time, that is related to inflammation of sigmoid colon. And with yet another parasite, Strongyloides stechoralis. Okay, so once we see this tool, etalon object, let's go ahead and press vegetative test button. This will allow us to test the very percentage to which it would help, for instance, taking a certain drug. This could be allopathic or homeopathic, or a given laboratory that could be preset right here. And so click up, clear up, resolve. Let's take G, corresponding to homeopathic meds, and it tells us that in similar items it suggests Sormonale, Neil Labs. Then we read the description. We'll see that it's advised for chronic skin or mucosa problems, rashes, chronic bronchitis, gastritis, enteritis, hepatitis, vascular cardiac diseases, and this it's a neurotic syndrome, the nervous system, and so this is in the given moment, and so press on G forecast to see whether the system advises another drug. Well, yes, the same one. So let's do this. Click on it and then press on button vegetative test. So what the system is doing right now is testing how our intestine would react if we were to take the med. Remember, if we have a frequency for the equipment, we can send such frequency. Should we have it physical, let it be the med as such, we can send that as well. So, let's momentarily exit this window. Then Click on this option. This tool, Analysis Plus. This will allow us to test in which way the bowel would improve by taking this med. And so it tells us that there is strengthening of compensatory response in some 70%, and the disease is defeated by 100%. This as long as the patient remains constant with this drug, for as long as the doctor determines him necessary to be on it. Shall we push improvement button right away, we'll find that all areas which are sort of beading there where improvement has taken place, compare before and after treatment. Here it shows the name for the med. As for worsening, there is not a single area which actually worsens by this med.